Concerns about COVID-19 are growing once again. The CDC now reports the number of people testing positive in hospitals appears to be ticking up across the country.
This comes after the CDC stopped tracking how many people were testing positive once the public health emergency was declared over. ABC's Melissa Adan has you covered.
The number of COVID-19 cases testing positive during hospital admissions is rising. According to the latest data from the CDC, COVID hospitalizations have increased 12% in the week ending of July 22nd compared to the week before.
So when we start to see a couple of cases, it probably very much is the tip of the iceberg, meaning that many people are walking around with relatively limited to no symptoms and may not know that they're exposing it to others.
But health experts say despite the increase, COVID hospitalizations still remain at record low levels. The CDC says there were a little more than 8,000 weekly hospitalizations compared to peak infections during the height of the Omicron variant, where there was more than 150,000 cases each week. While most people don't report their cases anymore, medical experts say with the increased spread of the virus, it's important to take precautions, especially if you have underlying health conditions.
When I see those numbers bump up, that's when I pack my mask in my bag. And then, of course, if you haven't done so already, make sure that you're up to date on your vaccine status.
ABC's Dr. Darian Sutton says the country is likely dealing with an Omicron subvariant, which means Americans still have relatively strong protection from vaccines.
And we'll still continue to pay attention and monitor these variants because inevitably we will likely see a different one in the future.
Meantime, the federal government is setting up a team to study the impact of long COVID, helping treat people still suffering with long-term effects from the virus. Melissa Adan, ABC News, Los Angeles.